All right, team, we have gone on 12 o'clock, so we're going to get started with our webinar today. This is exciting to be hosting our second AI webinar in the series of 3 that we've got going on over the kind of October, November, December period. So the first one we did was around kind of the useful tools and tips and tricks to know about AI tools in general practice and primary care. And today we're doing the deep dive into the scribing tools, and we've got a beautiful panel for you to help bring that concept to life. But I'm going to open up our webinar this afternoon with karakia, and then I will introduce you to our panel before getting kick-started. Tūtawa mai I runga, tūtawa mai I raro, tūtawa mai I waho, tūtawa mai I roto, kia tau ai te mauri tū, te mauri ora, ki te katoa, haumie, huie, tae kie. Look at all these people coming and spending their lunch with us. How lucky are we? So good to have you here. The session is being recorded and will be uploaded onto our YouTube channel. So if you think it's riveting and you want to share it with your friends, you can do so afterwards as well. So we're going to talk about effective AI live scribing. So what we're going to do is I'm going to pretend to be your patient. Carl's going to be Dr. Carl, and we're going to live scribe with Nabla and Heidi Health as the 2 tools that we're going to showcase for you today. And then we're going to come back and have a bit of a discussion with our panel around how they use the tools in their work. So Carl is a GP joining us from Auckland, and we've also got a couple non-GPs that like to use AI scribe tools as well, which is really awesome and great to be able to have some diversity across our panel today. So I'm going to hand to Sandra to introduce herself and her role, and then we'll go to you, Amelia, and then we'll finish up with you, Carl.
Hi everyone, I am Sandra. I'm a urgent care clinician in Stratford in the Taranaki. I have an extended care paramedic background, working in general practice, come off working out of a car in the ambulance service to general practice, where I've been here now for approximately 2 years, setting up an urgent care clinic, now going for walk-in patients, which is really cool. So yeah, we use Heidi in our setting.
Beautiful. Kia ora. And Amelia.
Kia ora koutou. My name's Amelia Howard-Hill. I'm a nurse practitioner based in Christchurch, predominantly working in musculoskeletal care.
Beautiful. Bringing the allied health lens to our corridor today. And
yeah.
always a pleasure to have a nurse practitioner in the room, in the virtual room. So kia ora. Thank you for joining us. And Carl, kia ora.
Kia ora. Carl Colney Nai Tahu. Te waipa no me. I'm a GP for now 30 years, coming up this year. It's hard to believe. Military experience for 10 years and done lots of IT stuff while setting up a health hub. And very interested in IT for the last 10 years or so. Half-time practice, half-time trying to change the world in IT.
Beautiful. And you've been a GP nearly as long as I've been alive. How great is that?
Yeah, I know. Remind me, my kids remind me too. Yeah.
I always love that. So good. So just a quick reminder to our audience, if you'd like to get some college CME points, you can do so and claim that through this webinar today. We are registered provider with them, and you'll be able to do that by following the links on their website and through the login channel there. So what we're going to do is we're going to kick into a little bit of a live scribe. I'm going to give Carl a call. He's going to be my doctor today, and we're going to go through both Heidi and Nabla. I guess the challenge to the 106 people that have joined us today is write the notes as we go through this consult. So without Nabla or Heidi, what would you write as the notes? So what if you were to do this without the AI technology? Sit there, type, write down on a piece of paper, do whatever works for you, but use this as a bit of a learning opportunity for you to write the notes of the consultation, and then you can compare your notes to Carl's notes that he's going to show us through NABLA. So that will be a really interesting thing for you to do. But I might just hand to you, Carl, and you can take us through a few tips and tricks on these tools before we get started.
Thank you very much. That's a good start. I've got to turn myself off mute. On a classic beginner spot. So you can see a screen. There's we've got Mickey Mouse Jess, and I'll do this as realistic as normal as possible. I've done a few of these. It's a little bit kind of artificial to try and do it, but we'll make it as realistic as possible from a history point of view. I've got Nebula and Heidi, which I'm using both for Nebula for the last 18 months and Heidi for the last month as examples to be able to show you how I use it. And really, we're going to be pretty fast. It's not going to be, please don't pick apart my console because it's going to be for the purpose of demonstration, but we're going to make it as realistic as possible, and Jess rings me in a minute. And just to show that, it's not perfect. You had to learn how these things work. The biggest tip I have around the AI Scribe since I use them is I was wowed by them, and after 10 years of working in IT as a senior responsible officer for big projects, I wasn't wowed very much in lots of demonstrations, but then after the honeymoon period, I realized the sort of mistakes you can make with it that are different mistakes that you don't make when you're writing. So the kind of new errors you have to watch out for, and I'll go over those when I look at them. But by far and away, I can't operate without it now. I'm mildly dyslexic. I can't spell things on the fly when I'm particularly stressed. I hated writing notes, hated it for vengeance. So it probably makes me more biased towards using some kind of scribe. And I'm much more discussion and more conceptual. I like IT because I do lots of whiteboard demonstrations and do the Rubik's Cube with signs and symbols, not words. And I'm very emphasizing self-management and really like patients to be involved in their care. So if you don't verbalize those things, the scribe won't do them for you. So they've found why I think it's probably worked out to be for me so well, the combination of those things. You do have to practice like everything, and this allows you to practice quite easily. And my family went for a few practice consults before I started using it in the real world. So Jess, if you wanted to, should I go through quickly what I like about NABLA layout first before bringing it up? Here's the layout. Being a browser-based system, when you log in, you get free use, like most what's called cloud-based systems. You get a level of tiered, and you get a certain aspects when you're free, and you can practice pretty much the full functionality for a certain level on both Heidi and NABLA, and then you pay for more extra bits. So you can actually try it before you buy pretty easily. On here, I've got a line of previous consults, but the biggest thing to learn, I've learned in NABLA, is the prompts and your layout really matters to your style. I've sort of settled on a template here under the settings where I have assessment, plan, subject, objective. So it sort of puts the plan assessment at the top. Walk-ins or other consults, it's, the progress notes, sometimes they have to be full-on new patient notes. So you need to be able to adjust, but predominantly there, and I've settled on this prompt here, which you can customize for yourself. And we'll show the output, the difference this does to that, because the key is the prompt, your layout, what you want it to do. That makes a huge difference to how it goes through the transcription. The other key is I've stayed well away in this product that is from things that suggest diagnosis or tell you what to do or bring back. All that stuff is very hypothetical, probably will help, but this is purely like a blind medical student who can hear every word you're saying. You have to describe things, but they've got no ability to diagnose. So this is a transcription, and it turns those words into probabilistic matching, like what's the next most likely word. There's no thinking involved, and the moment you think it's thinking, you're in trouble. It is purely a series of probabilistic words based on your words. So if you don't say it, you don't. And if you don't have the right prompts, and I've changed my wording a bit more when I discuss with people, I'm much more verbose when I'm doing a description of their back exam. I'm doing your tummy right now, which is all good for the patient to describe what's happening. And also, I haven't had to change much, but if you don't describe what the options are, what they should do and involve the patients in the plan, it won't get written down either. So you've got to say what the options are. But it does tend to be verbose. So I've tried to, and this has been a good prompt for me, make a concise summary at the top, like a headline, and then I use the rest of the history if I want to, and as I'll show. As you go through here, I won't go through all the details, but you can do a lot of fiddling with the, is it bullet points or is it graph, paragraph or auto, and you can make custom instructions under each of the settings of assessment, subjective and objective. There are all the other kind of styles of notes you could have, like a full-on normal medical student admission to hospital note, down to other sections. So without further ado, do you want to give us a call, Jess, and we'll do a consult note? You'd start with here, and I'd go, I can make a straight dictated notes or start a new encounter. I'll be ready to go, and call the patient from the notes, from the waiting room. Who's going to call me on the phone right now? Go into a bit of detail. You can actually set it up that will run on a video call like this, or it's in a phone call, and then it's not going yet. Hello, Jess. I'll just put you in speakerphone. Go speakerphone. Hello, how are you?
Yeah, good, thank you. We're just going to sense from Sandra and then Amelia if they can hear us. Yeah, cool, perfect.
Okay, so nice start encounter. I liked and still like the Nabla side that I can see the words. I usually go pretending you're in the room, Jess. Like I'm using this digital assistant. It really helps me make better notes and makes me not concentrate on the screen so much. Is it okay if I use it? I think it's very good. It's got all the privacy stuff. I delete it afterwards. Are you happy that I use it?
Yeah, absolutely.
And I have that point to the screen, so I've got two screens so patients can see it. And I think this is quite cool. They can see it coming up. There's usually a few people go, oh, wow, man, does it understand if I say, and yeah, it does. And then so it really makes it obvious for recording, so that's good. And then I'm going to, okay, so Jess, what's happening?
Oh, I'm just so tired. I've been super fatigued over the last few weeks, and I feel like it's getting progressively worse. I know we're coming into the holiday season and the end of the year and everything's building, but it just feels a little bit abnormally off, and I feel like I need to sort that out before I get to a stage burnout.
Oh, okay. How long's it been going on for?
I've noticed it over the last 4 weeks, but progressively getting kind of worse over the last week and a bit.
Oh, that's no good. Okay, so 4 weeks ago, going back before then, you're basically normal, not too bad, nothing.
I've got a 2-year-old at home, so
right.
I don't think that this is ever normal, but I think I'm feeling okay and functioning okay. So now I'm finding it really hard to get up in the morning, really hard to get through the day, and just battling a little bit.
For the last 4 weeks, every day, okay. You don't look like you're too low or down. Do you think your mood's changed at all? Or is it just more tiredness only?
Yeah, no, I've definitely been a lot more grumpy. I don't know if that's a side effect of tiredness, but definitely felt a little bit shorter in my, I guess, mood and personality.
Right, okay. You mentioned a 2-year-old. You're a solo mum or married?
Yeah, I've got a husband.
Okay, and you're working full-time?
Yes, working full-time.
That's pretty busy, but have to ask, sorry, could you be pregnant?
Oh, I hope not.
Should we check that?
Yeah. I haven't done a pregnancy test, and I actually can't remember. I think my last period would have been about 5 weeks ago.
Okay, well, we better check on that. Your periods usually pretty regular?
Yes, they are, although, they're generally pretty regular.
Right, okay. Well, we better check on that, but it's been pretty early to feel that tired. There's other reasons too. How's life at home and work? Is things getting stressful? Is work a good place? Is your boss a good person?
My bosses are great people and love the work that we do. But yes, it is very busy and it's a lot to be, I guess, putting on top of a young family as well. So it is, it is very time-poor person, but very satisfied in the work that I'm doing. I don't believe that it's stressful or providing extra kind of stress or anxiety to me.
To what you normally do, right? But you're working 2 jobs really, one paid and one at home not paid, right? You go home, you don't have the time you used to have. I often imagine before kids, what do we do with our time? Our weekends and evenings are not ourselves anymore, right? Okay, but that's changed. Look, I'm looking back at your notes. The nurse is right to call you, and I think This is just a quick fit in, and I can see everything else in your obs, your blood pressure, your pulse is okay. Nothing else has been wrong in the past, but you haven't had any bloods for a long time. You've got anemic in your pregnancy, I can see in the notes. So let's test and do some blood tests, and you can come back after them and we'll go for a bit more of a thorough exam. Use things like possibly thyroid, but your iron levels and things like that we can rule out with those blood tests, and then we'll go through in a bit more detail, okay?
Beautiful. Thank you.
Any questions about that at all?
No, that sounds like a really good plan, and I'll get on to that blood test.
Okay, we'll get the blood test done and we'll go. Cheers.
Beautiful. Thank you, Doc.
Bye. Okay, where are we? We're still showing the screen. You guys are over. Whoops, how do I move this? You are over my generate button. Now press generate button there. That generates the notes based on that my pre-saved template. I can show a bit later those, and this is what takes us time, and it's the summary. So I'll zoom in a bit. I don't know how is that, but is that better view for everyone?
Yeah, that's a bit better.
So and I have got some people reached out to me, and I've done some comparisons, and out of the box, they would say about half the time it's a note they would think would be acceptable. Other times they say about a quarter of the time it's well off, and I've certainly had that where it's gone off sideways for some reason. And there's about 10% of the time they just wouldn't use it, it's missed things. Again, what I was saying before, I hide the detailed history section. Sometimes I might use that as a new patient, and an exam section here, because I'm finding more and more as we do with general practice, we have to zoom in into the main problems and then make a plan and come back. The blood pressure's already done somewhere else. The nurse already recorded all that. Why do we repeat it all? And so one of my drive to be efficient, trying to do the bits that matter. So sometimes I'd only just do the summary, but I've made in that prompt at the top there. We've got a Dr. Randall in our practice who's very precise and very shorthand in his notes with a lot of abbreviations. So I call it the Dr. Randall note, where it's just that's the note, and I'm going to see you tomorrow. And then it's got these are the assessments based on that template. If I went back to another template, for example, here, and changed this into a multiple section template, back to this, and I rerun that same. Sorry, struggling with the rerun that. I lose that because it's now done, and it's just doing all this really amazing probabilistic maths and work maths quickly on this transcript, which is what we transcript there, which does get wrong. You might have noticed as we're talking that can be wrong, but it's quite amazing that it doesn't matter because it looks for word association, still comes up with this. People say it invents things, but it's might through misconnecting words, but it's not telling you what to do. It's purely a scribe. And if you didn't say it, it shouldn't come up. But it can be misconstrued. And see, this is a much fuller template of what we're planning to do effectively. And where we go from there. I forgot what we're going to do next, Jess. Do you want to do a Heidi one straight away, or do you want to go into a discussion?
Yeah, I think we'll just open up for a few Q&As before we go into the Heidi demo. Chris has got one in the chat, or sorry, in the Q&A. So if you want to ask a question, please put it into the Q&A function rather than the chat function, and we'll be able to go through those in some kind of chronological order. But Chris has a really interesting one here around, I obviously have quite clear English. English is my first language. What about people who English is their second language or are wanting to talk in different languages? Can these tools support with some of that translation or pick up when people's English isn't as clear as what maybe mine is?
Yes, they are starting to. I must admit, I haven't really explored that much. It's absolutely shocking at Māori, and I, that's something we have to live with for the moment. But I hope, like in most of these things, they expand their language. They are focusing on North America because that's where the money is. When I first started talking to NABLA, they would respond to me within the day, and then they sort of got slower and slower and focused so much on America, and they've exploded. With a couple of big startups there, and they are doing Spanish, of course, because of their. It is a dilemma of feedback because they could very quickly, if you give the transcription. The other important point on here, you'll note they they ask you to rate this note and send it back every time. The default is not to, so nothing is rated. They don't know any idea how accurate this is compared to that transcription, and they've got no idea whether the audio that transcribed to this is correct, because the default is not to send it, which is what they probably why they were so successful in the States and went into sort of like 65 massive places in the States so quickly, because they were aggressively about that privacy first, better than most IT systems, to tell you the truth, to the point where that meant they couldn't learn. So you have to say yes to per consultation. I have to rate it and then generate and send a copy of the transcript. So until you say yes, they're not going to learn. Yeah, so that's a dilemma. But it allows us to then maybe keep it to a New Zealand specific thing if we ever do it future. So no, and I am amazed how well it understands my bad Kiwi accent mumblings.
Beautiful. Sandra and Amelia, do you have anything to add?
Sorry, you go.
I haven't used Nabla. I've used Heidi, but Heidi does have an ability to translate, and so I have found that very useful after generating the consult, then regenerating it in the language of the patient's choice, and sending a patient summary in their language, which is amazing. Obviously, I can't.
I've got patient instructions. You bring up a good point. That was one of the things that really made me love it. I had a Maori woman come in afterwards and say, I understand why I'm on INR and the bleeding, all the stuff you think and people have been told, and she read it. It was in English, but she was absolutely amazed, and I understand now because the instructions were just in a more appropriate language.
I haven't used Nabla either, so I can't comment. We have Heidi.
Beautiful. Cool. We have another question here. Did you set up the template, or is there standard ones that that Nabla comes with, or Heidi comes with? Are they kind of
Nabla and Heidi. We're going to go for Heidi in a second. Part of Heidi's approach is it's got a bit smarter around the templates, I must say, and something around the context. But there are these standard templates here, which seem rather random, and they kind of are. And then there's the one when I'm used here, where then you can customize them with your where is it? This bit in here. So a year ago, this is just you had no customization. Now you can customize the title, and then you can decide, do you have the problem split? And because I've been there for 15 years, got a lot of older patients, I've come in with 6 or 7 problems, so it's quite good to have the problem split. Some people might not like that. You can adjust this, so you can customize this. This is the bit that I've customized with a bit of practice that creates that bit at the top, which just in my more busy style practice has been very, very useful. So I produce because it's just too long in most notes, really, especially when you see multiple other patients and the notes are pretty full. You just need your bit. So I tend to make it very much just that summary note, which should generate soon. Heidi, which we'll show in a bit, and sounds like the others got more experience than me because I've only been using it for the last month, has got that really clever open source is the wrong word, but library and publicly available library of templates, which I see as a huge, it could grow into a real valuable way. So you go, oh, this turned into a mental health consult, or this turned into a 6-week check or something, and boom, you don't have to sort of redo a whole template to start a form. It just puts it across. And I can see a day where it actually would possibly come along and go, hey, you forgot to ask this. So you can go in and check it. So it can do a sort of cross check for you too. So, and this,
Belinda asked, so now that you've got my notes in there, do you just copy and paste them into the PMS?
I copy the whole note. I change it here sometimes. You can dictate straight into it. I go, here we go, dictate. I like this a lot. So, and I forgot to say she needs to be followed up for a skin check from weeks ago, and we'll remember to do this tomorrow, whatever. And I found this to be very amazing because I've used Dragon Dictation in the past, and it's just astoundingly better. And then they brought this out very recently too. Wound check, much improved, but slight redness down left edges. Continue review in 2 days. Full stop, new line, blah, 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 full stop, new line, don't start anything. I mean, it's just a different level of dictation. So even that is quite a lot level with the smarts behind it. I gave up on Dragon within about a week of trying it a few years ago.
Beautiful, cool. Jill has asked how much of what you can see on your NABLA account is part of the free version and how much of it is part of the paid version, and do you recommend getting the paid version?
The free version has everything you got there, but I think it's 10 a month, so it's sort of enough to try. But yeah, it's one of the services where you get everything but a limited number per month. 10 is one morning, half a morning for me. So I do recommend the paid version if you like the dictation side, but I'd also try Heidi. It's getting popular. There's some rumours around them sharing information, but they, through a privacy audit and through direct from them, they don't. I don't know why that is. I think there's a lot of mistrust, as you should do, verify, but I don't see any problem with them myself. I thought I'd try them. I must admit, I'm so used to one system, it's hard to change. I was so used to seeing dictation when I transcribed there, but it's got a lot more of this post form, especially making work forms and other letters that could be quite good. So I'm trying it, and here was yesterday, I tried it. Yeah, I think they both got their pluses and minuses. You cut and paste back into the notes.
Beautiful.
Practice.
And I think, Joel, your question was around, is it compatible with MedTech? It actually sits outside in your web browser, so outside of your PMS, and then you copy and paste the notes over. So you can copy and paste into any PMS or any document that you like. It doesn't need to be integrated through the Alex app or anything like that. And then Emma has asked, I see you're using Indice. Would you recommend using the microphone in Indice to transcribe rather than, I guess, the computer?
I did try using this in the past, and it was definitely slower and not nearly as good. I don't know what the difference is. I think it's because of the AI or speed or something else.
Okay. Yep. Cool. Hopefully that answers your question, Emma. And Vicky has said, in terms of time, what sort of efficiencies have you been realising for your practice?
I was getting up to an hour behind. I must say, COVID was bloody hard. We had a lot of violence. We had things outside. It was getting pretty burnt out. We've had to have gates upstairs. We had homeless outside, so it was getting very tiring. And the people talk about the overload with things in South Auckland with rejection referrals that's been going on for about 5 years. I think the measure is the dread of writing notes at the end of the day when I've got really behind. I've had to skip through the last 4 and have to remember what's happened is gone. If I haven't written the notes, at least I've got a memory jogger. And I've re-engaged in trying to emphasise that I'm there for the patient, not looking at the screen as much. So I think time is, they try and sell that, and it probably does save about half an hour a day, but it's the cognitive load and the relief I find. And also I've noticed that it's got more of the patient story in the history. It's not all according to the doctor's memory. And that's what my colleagues in the hospital who unofficially have been using it, because I'm not allowed to, on the sideline, have found it as useful as purely a note taker. And even if they don't use the notes to create the letter, it helps them remember at the end of the day. Yeah.
Yeah, beautiful. Amelia?
Yeah, I agree with Carl. Look, I do think it does increase efficiency. I think it makes the biggest difference on those horrible days where you just get sidelined by lots of random stuff that you weren't expecting, and you're having to come back retrospectively to do those notes. And that's where it's gold, because it's much sharper than what you recollect 3 or 4 or 6 hours later.
Yeah.
And so that's probably where it really comes into itself. And then the added efficiency, if you're having to arrange referrals to multiple providers and things, is that you can do that through the help of templates that you set up to kind of regenerate that for a referral and things like that. So that's where it really makes a difference as well.
Yeah.
Beautiful. And Sandra?
Yeah, I agree. as a walk-in clinic, we especially on Mondays and Fridays for some reason we get slammed, and trying to remember everybody that's come through before we used AI was really, really difficult, because you get stuck behind and you knew you had a whole caseload of patients sitting out in the waiting room and trying to get those notes down. So this way's really good. It records it all, and you can easily go back and jog your memory with it later on if you have to. And with the microphone attached to the back of our trolley, we can wheel the trolley to where the patients are and just keep talking, and we don't have to worry about a computer, because it's actually, as long as you verbalize everything that you're doing, it's picking it all up.
Yeah.
I've learnt it's like being in an OSCE for, doing an exam. You verbalize everything.
Yeah.
So if you're doing an ear check, you verbalize what's happening in the ear, and whether it's the left ear or the right ear, and it gets picked up really, really well.
Beautiful. You've nice little segue there, Sandra. What microphone do you use? You've obviously got a fancy Bluetooth one you can wheel around.
So it's USB into our computer, and it's round, and it came with it. I guess with Heidi, it just came in the box, and you just plug it into your computer, and we've just got it velcroed to the back of our trolley.
Nice, beautiful, cool. Amelia, Carl, which ones do you use?
I looked into it a bit, because I really tried to get dictation going years ago, because I hate writing so much. And also when I'm doing 5 things at once, and sometimes I'm seeing there and again interruptions. And these called omnidirectional microphones. But honestly, the microphones, I think Heidi's just got an app now, as I'm planning to try it, and you can run an app inside the thing. This is pretty damn good. If you've got a model iPhone more than 5, try it. It's amazing. They are very effective. They've got noise cancelling, but maybe not so directional. The one is called Snowball. They're about $100, and a couple of ones are made for podcasts. They're omnidirectional. They're really good in the office, because they get the directions, and you hear the patient and everyone else, and they can do the processing of someone who's further away and someone who's closer. But it's pretty standard. A reasonably good microphone does the job now. The processing is caught up with the microphones almost, because they've been good for a while, as long as you get a reasonably good quality one.
One thing you do have to watch, though, is if I have another provider come into the room to ask something, the microphone will pick it up and put it into the notes. So you have to be able to touch the microphone, turn it off while you're having that conversation, because otherwise you're going to end up with this random interesting note in the middle of your consult notes, which doesn't quite match the patient. And then you have to remember to turn it back on again afterwards.
Yeah, I've got a story about that, because that's the new kind of problems you don't normally have when you're writing in retrospect. There's a person that had multi-arthritis and really painful, and it wasn't getting better after a week, probably post-viral, and she was a young mum. So I arranged to go to hospital and spoke to the infectious diseases. I think it's post-viral, but she was really quite crippled by it. And I said, look, I had this strange reaction to rifampicin, and my ears went funny, and then I got really itchy feet. Then I got this kind of weird immunological things happen. We don't know what it is, and just explained to her while waiting for the phone call. Then I wrote the notes, quickly did it. I was behind. She was a fit-in, and then in the admission to hospital was past allergy to rifampicin. Oh shit! And I'd already sent it, so I actually rang up the infectious. That referral, it's got a wrong thing. I'm sorry, it's a mistake I made, because So if you're telling any anecdotal stories about yourself or something else,
it gets picked up.
Yeah,
definitely.
Awesome.
I was just going to add, I just use a Philips speech microphone, because we run Dragon and Heidi, so it was just what I had for Dragon. I have a colleague who uses the Snowball that Carl was talking about, and I think the Snowball probably is better, particularly when you've got like a patient and a whānau in a room, whereas the microphone that I run with is fine for the one-on-one, but if you start getting background noise, it can be challenging. The other entertaining thing that I think that fascinates me about Heidi is that if you have a chat about clinical stuff, it'll include it. If you have a chit chat about how's the family and how was the holiday, that doesn't get included. Like somehow Heidi can tell the difference between chit chat and consult. Like that blows my mind. It does.
Maybe we can test that one out a bit in our next consult on Heidi. I'll try and have some chit chat about how good my fishing is. There's a few more questions in here, but I'm just going to take a pause from the questions and we'll come back to you after we've done the Heidi demo, because I don't want to run out of time for that, just to show you the difference between the two platforms. So I'll mute myself, Carl, give you a call and we'll get going on Heidi.
On your demonstration about the chit chat, I did have someone who's bipolar who was becoming more and more manic and came in and just spent 10 minutes discussing things. I was trying to interrupt and I couldn't interrupt him, he just going off. And I managed to get him some support, come in, and I pressed Heidi on the whole time. It transcribed it all. And it came up, no medical information in this transcription at all. Well, that's true, yeah. Never seen that before. I go to Heidi. I'm still sharing, aren't I? Hello. Hello, Jess.
Hey, Doctor, how you going?
Hey, Jess, how are you?
Can you hear me okay?
Yes, I can. I think I'm showing my my lack of experience of Heidi. This is a new system I'm using in the UK that I told you last time I was using a digital assistant. I've changed to another one that's testing my cognitive abilities. I think I've started it. It's going. It's part of this new system really makes us efficient, so I can fit you in. So we've got your blood results. Good news is you're not pregnant. I guess you'd be happy to know that. How have things been?
135 people spreading rumours about that. That'd be terrible.
How have things been with you the last couple of days? Yes, any difference?
Yeah, a little bit. I'm struggling to get out of bed in the morning, but I've been trying to be mindful about, finishing work on time and, going to bed at a reasonable hour and getting a little bit more nutrition in my diet, and that seems to have helped.
Yeah, okay. I just realised looking back at the notes, we didn't really get into your sleep. We know that you're busy, you've got many things burning the candle at both ends, probably both ends, and burning the candle in the middle as well. It's just so much time pressure. How are you coping? When do you normally go to sleep? Are you sleeping as much as you used to? And when you wake up, do you feel refreshed?
Yeah, no, I don't think in the last 2 years I've ever slept as much as I ever have. It's been quite a sleep-deprived period of time with a 2-year-old or a baby that just doesn't love sleeping. So it's been a good journey. But yeah, I can't even remember the last time I woke up feeling, really rejuvenated and ready for the day. It's been quite a long time. I've been trying to go just the last couple of days since I've seen you, started to go to bed at 9 o'clock at night. As before that, I was, by the time I'd cleaned up all the kids' toys and done the washing and done all the things, it was kind of 11:30, 12 before I was getting to bed. So I definitely think the earlier bedtime has been helpful, but still haven't quite woken up fully energized.
Yeah, so it sounds very busy. And the important things around mood, you talked about being grumpy last time, but you seem to have motivation for things. You're feeling like you're motivated. You don't feel flat all the time. You're talking mainly a tiredness. Your mood otherwise is okay?
Yeah, absolutely. I think there's been improvement there.
No concerns there. Okay, your blood tests are all pretty good. Your hemoglobin is not indicating even a hint of anemia, and which I was worried about. And as I said, you're not pregnant. All those other basic tests I was talking about that can catch us out, I wasn't really too worried about, but like thyroid and that, all good. So I do think it's stress and time pressure in life. We're looking at sleep for the next little while. How many hours total sleep do you think you're getting on average?
Between 5 and 6 hours.
And before baby and in past years, did you used to sleep that little? And
no, never that little. I was always quite a solid kind of 7-8 hour sleeper.
Right.
So it has been quite a significant decrease for me.
Okay. Well, it doesn't quite explain why the last 4 weeks have been worse, but if you think things are steadily improving, you can concentrate on that sleep, and then maybe some minor virus that didn't show up in the bloods, but you've got over it on top of the sleep or other things. Kids are, as I'll have to say, the first 3 years are just a cesspool of viruses coming home, and you're just going to be swamped by these. And some of them clinical. Yeah, and we know you're due for a few tests with the nurse in a few months, so let's check in there. We'll do everything else. If you're happy with that, we'll go from there. Any questions?
Yeah, no, that's all good. That sounds like a good plan, and I'll just keep trying to manage my time a little bit better and get that those moments and windows and for some rest. So yeah, that sounds like a great plan.
All right, super mum. I'll see you soon.
Cool. Thank you. See you all.
Bye. Now, I think I just stopped. Say, God, it's differently watched. Now, what I learned that I do like about Heidi, and I'll have to ask people who use it more than me, is this free version allows you to have a standard output. And I've then realised, and I'm a little bit tricked, but it's my stupid fault. I did the 7-day free trial and I got to see all the different templates you can do, and that's what is quite amazing. There's quite a lot of templates you can change this to. And on the day 7, I went, oh, I wonder if that's come up yet. Will I carry it on tonight? And then the email came through. Congratulations, you've signed up for next year because you've. So, just as I was wondering, oh damn, I knew it was coming up. I didn't put up on a reminder. And so you get the free, and you get that whole put your credit card in for 1 year, and you get 7 years to look at all these. And then I went, it is worth it because there's some really cool templates that are from around the world, and you can go on and sort them. And I've got this NHS one, Canadian one. For example, so this is the default. So you get to check it out. You don't see the transcript as it's coming up, which I was no biggie really, but I was so used to seeing it as it came up from Nebula. I don't know the others have been trying this context part, which you can put some context that may change the thing that you might, but then you're back to writing notes while you're looking at the patient, which is kind of defeating the purpose, but maybe it could be good to put context in there. And I guess MedTech and Industry could actually then put this in there, and then you got your notes, and you can change this to being very precise or left and right brain. It's just a few settings like that, kind of how focused and detailed it is. Always like things brief. You can make it super detailed and run through that. I won't do this here to save time, but I recommend people just trial it, do a test one, and then try what difference this does to the notes. But what's really cool is, like, I can run this NHS one, and if you like these templates or you can contribute to them, it's run the same transcription and template. And I don't know how official this NHS one is. I don't know where they came from, but it's a template I use. And I always emphasise, it's face to face. That's wrong. It wasn't. Yeah. Struggling and these notes. We can go through this in detail, but I don't think it's worth the time because I think it's best to speak to the other panelists about their experience and encourage people. These things are free to use. If you test them on a fake patient or your family, you'll get to know. It's nothing like trying and seeing and feeling. Over to you.
Beautiful. Cool, thank you. And keep the questions coming in, team. We'll go through those and let the panel kind of work through some of the answers, and they're also being answered in the chat or in the comment sections as well, which is super helpful. So thank you, team. One of the questions I think is worth discussing is did it take you long to learn and utilize? Like, what was the learning process as a clinician to go through this? And I guess my interesting recent experience with this is I showed a GP this tool a few weeks ago, and the next day he went back into his practice, and I had an email at about 4 o'clock saying, that's a terrible, turn that one off, Carl. You're sharing me back to the whole team. The GP said at 4 o'clock that afternoon, he said, this is the best thing. It's a great tool. I'm going to be, signing up and using it into that space. So it took him all of a day to be convinced that was his new way of working. But yeah, Amelia, you've shared a bit of your experience in the comments. But Sandra and Carl, what were your experiences with testing these? How long did it take you to get your heads around them?
We were just given it and said, here you go, see what you think. And the doctors had used it for a while, and they brought them into the 2 urgent care staff and said, right, here you go, this is how you sign up, see what you think. And so we've sort of been playing around with it a little bit, each of us in our different way, and learning off each other and getting different templates. So I actually use a different template to my colleague. He uses some, just a bit. we don't have to use the same one as long as we find one that suits us. And I guess I'm always careful that I read it back through, because sometimes you get things like a horse carrying a house when she actually fell over the horse carrying a box. So, you know, some of the story wording becomes a little bit skewed, but generally it's really good. I actually just learned a few things off you then, Carl, that I hadn't known, and I've been using this for a couple of months. So that was quite cool to be shown that. I hadn't been shown that, so it's still learning.
Beautiful, cool. And Carl?
Oh, I think that's right, Sandra. I've been using it 18 months and still learning. And I think if you're not comfortable looking a bit like you don't know what you're doing in front of patients, just practice outside with those people. And that's what I first did with NABLA 18 months ago. I was going, come here, say you've got a headache. And my daughter go, I've got a headache. No, say you've got this. And then I realised it is a massive spaghetti. Your notes can be all over the place in transcription, and it's just word probabilistic matching. So you do have to be super careful. And you can read it sounds all fine. If you start skimming over it, you'll miss something that's just completely crazy, completely nuts, because it's not testing any sense check. So you do that. So that's why I've gone more and more into more concise notes and more short notes. And every now and then, if it's become more complicated, there's that history one I use my NABLA that would expand. But I'm finding Heidi is pretty good at knowing that too, because consultations can vary so much. But that getting used, I think the biggest thing, the software, turn it on, it's going, and its output, you get used to pretty quickly, and you just feel free to, I have to remember that. I know it's going to remember it. And then I've verbalized and got practice more of repeating the output. You can repeat it with the patient not in their room, and then it will stress that more. The plan is, I say a lot, and it would be much more, put that in the plan. That's the only changes really. The rest is being learning to look for those errors that you'd never expect, because it's so different when it's not thinking. It is not. I hate the word hallucination because it makes it personified as if it's a person or it's thinking. It is purely, matching words by chance, and it needs that level of reading over a different view, that kind of critical review. Yeah.
Just responding to the question from Elizabeth, it does pick up family members, but it doesn't separate them out on your notes. So if a family member says something, it may go into the notes, but it won't be separated out.
Yeah. I would just also add that for me in my practice, I use quite a lot of te reo, and that has been problematic in that Heidi has had no ability to interpret that or transcribe it correctly. Heidi has the ability to try and kind of develop the notes in a way that sound more like you. But my notes have, in some respects, stopped sounding like me because there's now no te reo in my notes, if that makes sense. And so that is a change for me. The other thing that I've learned I've had to be very careful from is that when you're out, particularly when you're doing your examination, I find what gets missed is your negative findings. So when you say no patellofemoral crepitus, sometimes what you will get is patellofemoral crepitus, for example. And so it's really watching those things, as it's usually really good at picking up the positive findings in your examination, but sometimes they can turn your negative findings into positive findings. So you really need to look for that. And with Heidi in the background, you can teach it to kind of go, when I say this, I want you to write that. And so that they kind of really capture, like when you kind of, there's sometimes medico-legal things that you say in your practice that you want it worded in a specific way, like when you've talked about the risks and benefits of a procedure or whatever. And so you're quite specific about how you want it written. I've just kind of taught Heidi that. And that has been useful because I felt like Heidi had been too succinct and hadn't really outlined the risks and benefits from a medico-legal perspective. And so you can train it kind of in the background, and which also makes a difference.
Oh, beautiful. Great. And you've answered a couple questions along the way, so even better. There is a couple questions in here about the cost and the comparative cost of the two tools. Carl, you just got stung for Heidi. What did it take out of your bank account?
I think it was enough to be stingy, but I went, oh, it's a year, so I think it was $800 for the year. Does that sound right?
Yeah, I think it's $7.99 or something.
Yeah.
And I think that there's a practice fee, which
Yes.
is really only worth it if you've got integration with your PMS, which I think is about $1,600 a year for Heidi, which we have literally, like today is our first day with integration. We're still running Dragon, so we've still got the $1,200 per user cost of Dragon. We haven't got rid of Dragon yet, but hope to.
Yeah.
Did you say integration, Amelia? Integrating into what? Into your PMS?
Yeah.
Which one?
Because we're a specialist clinic, we are with Alexa, and so they've just integrated with Heidi.
And it's Australian as well, isn't it?
No, Kiwi, Dunedin based.
Oh, okay, I know that on the Australian, that Heidi seemed to be focusing on that in the integrations, but here, okay, all right, learn everything, something every day.
And what is the cost of Nebula, just in comparative of the $7.99?
There's a few 15% discounts. I think GP Aotearoa's got a discount that's about $120 Australian US. So it's more in the 180-ish per month. So it's a fair bit more than Heidi, and that but it's monthly, and you can stop at any time.
Yep. Beautiful. Elizabeth just asked if you can zoom in again on the note from Heidi and zoom in again on the note from Nebula, just so we can see that a little bit more clearer. And I'm really keen from anyone in the audience who might have written the notes themselves, and if you're keen to share with us your note taking so we could compare, just maybe put a comment in the chat saying that you're okay to do that, and we can make you a presenter so that you can show us your notes. So those are the Heidi notes.
This is and the others who do it more than me, but what I have noted, and I can see being a fantastic thing, is you can see I've got ChatGPT here because I'm using that anonymously. I don't think you should put any patient information in ChatGPT, and I don't think that you should trust it to summarize stuff you haven't read yet. I think that's coming, but this is stuff you've just talked about, so it's in your short-term memory, and you can decide if it's wrong, and it's going for huge notes, and you haven't read it yourself. I don't think that's ready at all, just to be clear. But I have used ChatGPT to say 32-year-old, 26-week pregnant, autistic son, peds, say needs care, living in a hotel, 1 bedroom, needs support, housing, something really short like that. And ChatGPT just writes this brilliant letter, 2 paragraphs on how she needs that, because you've set it up to be, I'm a primary care clinician, I'm talking to housing that knows all this other context. And I think that's where Heidi's going to go. So you could go along and you can ask it to do anything here, or do these other notes. And I could see the templates we've got in our systems for wins that this person needs to be a care worker. All those kind of templates we've had will just become part of this. So ED mission note, I don't know. And that's what I'm just starting to get thinking. If anything that's going to make me move to Heidi, because I'm still prefacing Nebula, probably because I've been used to it and grown with it, is something like this, because then I could just go, oh, it's going to do this other part we do quite a bit, creating letters, follow-ups with schools, and that just bang. I can imagine us at the end of a consult saying, hey, make a letter about this, and it would actually do it without us having to even touch the keyboard. This is, I've ruined that Heidi one, so this is the Nebula one, and that's your notes from that first there. That's the summary assessment plan. That's that one I've asked it to do, and I added that bit by dictating, didn't I? There. This is the 2 problem list space. It made possible pregnancy a problem. That's interesting. Would you bother to do that? I don't know. I would have. And then this is the history. But if this is more, it just turned into, say, a very deep depression and suicidal, it might be there. I'd include this possibly more, and end up having to draft more of a note and cut and paste parts of this over into the notes here. How I'm working at the moment. It really made me think, especially in general practice, what we're doing is every consult can be so different, So you need to be flexible. Yeah.
Just
Beautiful.
answering Shelley's question, on this, if you go, can you go back to the other one?
Heidi?
Yeah, Heidi, sorry.
Yep.
And then go to view sessions.
Please. Yep.
Yeah, that one. Shelley, you can see down the side there's a whole lot of sessions that have been recorded, consults that have been done. You can go back to them and copy and paste. So it doesn't matter if you need to quickly move on to another consult, you've got your other ones still there.
Yes, and it's still pretty anonymous. That's the benefit of doing this all outside. So here's one I did, just check it is anonymous. Sometimes they put names in there randomly. I think it's anonymous, and it's these sort of pseudonymized when it's processed, but it still has a name sometimes. But that's these ones, and they keep them for a certain period of time or a certain number. You can go back. Yeah, and I've done that back into just keep ahead, and then I'll go back and I've edited and put them back later, especially for fit-ins. Yeah. And this is where, if I'm not going to try, you haven't got a microphone yet, do try it from your phone. Yeah, you can log into the same account from your phone, and if I was logged in here, it would just turn up, and this is another note down here out of my phone. So it's quite amazing. I'm pretty sure Heidi's just got an app that you download. You use the same account, and it'll turn up in this list, and you can go, that was the one I did in the side room, and that's the output, and it's in your desktop. So that's quite cool. You can actually sort of have a mobile scribe.
Beautiful. Very cool. All right, we've got a few more questions coming through the chat. So I might just direct the panel back to answering some of those questions. And I'm going to give one question to kind of close up our webinar today to the panel to lean into. And the question is how do you envision AI scribing fitting into the daily workflow of general practice, and what do you think the key challenges will be? And that's probably for somebody that's not got it currently, and what is your kind of advice in that space? So we might start off with you, Carl, we'll go to you, Amelia, and then finish up with you, Sandra.
I remember when webinars were a concept that I was told by the board at ProCare 15 years ago that they would never, ever do education online. It always has to be face-to-face, and it will never be good enough. And we're trying to get $1,000 per month to pay for WebEx back in 2008 to do remote to the practices. It's really hard to imagine what it does do, and it gets exaggerated, and it will fill a gap, but it doesn't do everything. And the other thing I think of when you ask that is, a great mentor of mine once said, when someone gives them a hammer, everything starts looking like a nail. So you start going, this is going to replace everything, but of course it doesn't. It's got real limitations in some areas. It's got massive limitations in diagnostic coming to conclusions, because it's not got any deductive reasoning behind it. But in that kind of scribe recording what you said, it's a real game changer. It's a new tool. But it's not the only tool, and it's inappropriate to use somewhere else. Like a hammer is a really stupid thing to use to try and get a screw out of the wall. So it's going to be game changing in very specific areas. And for me, the note taking has really helped. Writing patient instructions in certain times, it's really going to help. I think every single consult note in the background could be put into a patient instructions once we trust it enough for the patient portal on fully open notes. That would be really great. And I'm watching closely the next step, which is AI agents, which is very much using the same kind of software, but it's actually talking back and forth, where you can give someone a course online, say, hey, you're diabetic now, here's what you need to learn. It uses a trusted source like Healthify and modifies the output to you based on your input, so it can guess what you need to know. So I think that's kind of the self-management patient communication side is going to be the next growth area.
Beautiful. Thank you. Amelia?
Yeah, I agree with what Carl's saying. I think that the other potential kind of next thing that's going to happen is, which we're sort of trying to look at the moment, but it doesn't have capability with our information systems, but there is kind of apps that you can get to try and automate from an AI perspective certain functions within your practice. So yeah, for example, a patient completes a patient registration form, then the AI goes, okay, well, the next step is to book them appointments, so the AI will send them a link to the online calendar so the patient can book an appointment. So I can see that the next thing will be to, like, from an admin perspective, to really help those kind of journeys that someone physically is doing that at the moment, whereas that will become automated with some more simple things. In terms of the other thing that I was just going to mention that I think isn't, it's not really answering Jess's question, but is another benefit, is that we have noticed that we have had a few patients, because we're a private practice, that have complained about costs, and some of them will say, oh, I was only in that consult for 10 minutes. Why should I have to pay a full consult fee? And actually, it's quite useful when we can go back and check the transcription, and we can go, well, actually, no, the actual transcription for your consult was 46 minutes. Your perception might have been that it was 10 minutes. That's great that it flew so quickly, but you know, you're paying for our expertise, and actually your perception is not based on reality. We also, one of my colleagues also had an experience where a patient suffered a poor outcome from surgery, and then did that classic, well, if I knew that that was going to happen, I never would have consented to surgery. And we were able to go back verbatim, swap it back to the transcript and say, here is what was discussed for your surgery, because, you know, the letter just said risks and benefits of surgery discussed. And we're able to go back and say, look, this is what was covered. And that kind of stopped at the pass any further complaint, because the patient went, oh, I'd just forgotten that. So that was also very helpful.
Beautiful. That's I'm still waiting. It's about 4.5 weeks later for my husband's GP to write the note from his consultation. So I do think, you know, sometimes we've got to like risk versus benefit, right? Like, is it better to have no note in there, or is it better to have an AI scribe note? Yeah, so I think some of those things we do have to kind of take with some good balance. But those are some great examples of how it can help you get through some of those medical legal kōrero. Sandra.
Well, from someone who said, I never want to use AI, and my partner works in AI, and they're like, well, it's coming. I was like, no, I'm not going to use it. It was put into my room, and I was told, here, give this a go. The first day I was blown away, absolutely blown away. And I don't think I could actually do without it. It's picked up a lot of things that I missed when I was writing my notes. Some of the little, you know, you're listening, but you're not listening to some of those things. And so it's taught me a lot about that. I'm quite happy with it. And I think I'd like to explore it a lot more.
Awesome. Thank you. Thank you, panelists, for joining us today and for sharing your whakaaro. There's been a few questions in the Q&A today around data and where is it being held and where is it being stored, and that privacy element. A few questions kind of relating to ethics. So webinar 3 will maybe be the place for you to come along to. It's being held on the 11th of December. It is our Christmas present to you all, where we're going to talk about ethics, workforce readiness, and managing AI risks. The session will be exploring ethical considerations of AI in healthcare, emerging trends, and strategies for building a digitally skilled AI-ready workforce while addressing potential risks. So we've got a really good lineup there. I believe we've got Rochelle Stiles joining us on that, so we will have a good legal ethics perspective in there as well. So it'll be a great one for you to come and share some of that thoughts and processes around, the other things that you need to think about when utilising these tools. And one of the things brought up in the chat today was around the sustainability from a environmental perspective that AI is bringing in, and I don't think that's a problem for, hopefully that's not a problem for Collaborative Aotearoa to solve, but it is one that I think we should all be cognizant of in the work that we're doing. What are we doing to kind of outbalance that, right? So I'm going to close our webinar today. Sorry for running a little bit late. We just got a little bit caught up in our consultation and having a good time with you. I'm going to close us out with karakia, and I wish you all a fabulous Wednesday, and we'll see you back here on the 11th for the third and final webinar. Clothing karakia. Kua wānanga mātou kia whakairia te tapu, kia wātea ai te ara, kia turiki whakataha ai, kia turiki whakataha ai, haumie, huie, tae e kie. Ka kite koutou.